Happy Easter once again to the children, of course, to the adults and all of our viewers out there. Now, let's delve to some other issues, which is the promise that the government, the federal government of Nigeria, through the National Primary Health Care Development Agency, will be increasing the number of primary health care centers in the country from 8,800 to about 17,600, but that will be in 3 years. I'm sure we've seen that news that 25 billion naira would be involved. And so you wonder, why is business discussing this? This is because the agency says it has engaged both the ICPC, the EFCC, and even employed some social accountability officers to ensure that these projects sees the light of the day and is functional. But let's find out how they are going to do this with the Chief Executive Officer of National Primary Health Care Development Agency, Dr. Muyi Aino. He joins us from our Abuja studio. Dr. Aino, good afternoon, happy Easter.
Good afternoon, Ini, and happy Easter to you. I'm
Great.
glad to be here.
So I have to tell you, even when we're having, I just was discussing this with my colleagues before I came on air, and they were like, well, it's not the first time we're hearing government make such pronouncement. And I tried to tell them that from my conversation with you off air, this should be different because you have the ICPC involved, you have the EFCC involved, and you even have special accountability officers. But convince us, Dr. Aino, that this will be different, that in 3 years we're going to have 17,600 primary healthcare centers around the country.
Thank you very much, Ini. I think I will provide a little bit of context and then get specifically to your question. So when I became the Chief Executive of the National Primary Healthcare Development Agency 5 months ago, plus a little bit, the Coordinating Minister for Health and Social Welfare, Professor Ali Pate, and the Minister of State for Health and Social Welfare, Dr. Tunji Alausa, had already articulated a health sector-wide strategy, which is the blueprint that is guiding the way we're thinking about the transformations that we're implementing to help achieve the renewed health agenda of President Bola Ahmed Tinubu. So we identified a number of issues at the time. Very quickly, really drawing from that and realizing again that the president had launched the National Nigeria Health Renewal Investment Initiative in December 2023, which had specific outcome indicators, which the president is really looking to deliver to Nigerians. Things around reduced mortality of mothers, of children, of babies, things around improved quality of health care. So better quality of our health facilities, better trained, better distributed, more competent health workers, increased coverage of important interventions like immunization, like antenatal care, and of course, better engagement with citizens so that we have a responsive health system. So we very quickly looked at all of that and developed our own strategic blueprint that is anchored around a number of things. One of it is, of course, the overall goal is to make sure that every Nigerian, wherever you are in the corner of this country, whoever you are, rich or poor, you can walk into a primary health center and receive the basic healthcare services that you need. So we're doing this through a 3-pillar strategy, but I will only focus on some priorities in the interest of time. So one of the things we want to do is to improve the functionality and number of the primary health centers, like you have said. So what we found was that even though there has been significant investments, like you said, prior to this in the primary health centers, many of them are functional, but there are many of them that do not meet the bar of what we would call fully functional, meaning people can walk in and safely and in a dignified way receive the services that they need. So the Basic Healthcare Provision Fund, which was established by the National Health Act of 2015, is the framework by which we are implementing these transformations using a sector-wide approach. Now, there are 8,306 facilities across Nigeria, primary health centers, that are currently receiving what we call direct facility financing, which is money to operate the facilities. Everything from the power, turning the lights on, turning the water on, getting some of the commodities that they need, but even where they need ad hoc workers. The challenge over the years is that there has been a number of gaps in the implementation of this. So there are some fiduciary issues, so things around transparency and accountability, especially as you move downwards to the health facility. There have been operational issues, so not as linked to the performance indicators as you would like, but also there are operational issues around what are the flexibilities that the facilities have to spend the money to hire the kind of workers that they need. So what the MOC then did, the Ministerial Oversight Committee met in December, where a decision was made to hold off on the disbursement of resources to the states through the major gateways, the National Primary Healthcare Development Agency being one of them, but also we have the National Health Insurance Authority, we have the National Centers for Disease Control, and we have the National Emergency Transport System. So those are the four gateways. Now, the MOC made a decision to halt the disbursements for us to identify, and actually the Honorable Coordinating Minister inaugurated a subcommittee co-chaired by myself and the DG of NHIA to identify ways to improve the spend of the money, so that ultimately it's towards a reformed basic healthcare provision program called Basic Healthcare Provision Program 2.0 that will be launched in July. But even before then, to say what are the immediate changes that we need to make sure that when funds are released to the states, that they will not be misused. So we have gone through that, worked with the states, worked with the development partners who are part of the Ministerial Oversight Committee, and identified a number of things. We will be using technology to really improve the transparency, so the visibility of what money has been transferred where from the ministry through the gateways, NPHD, NHIA, to the states, both the state primary healthcare development agencies, but also the state health insurance agencies, and to each health facility. We would also be able to track the expenditure at that level, at the level of the facilities, so that we can see where the money is going and ensure that the facilities are spending them on the things that they should spend them on. So in addition to that, we are then recruiting what we are calling social and accountability officers, who will be monitoring the performance and the financial management at that level. They will check what the facilities are doing. They are independent and will be managed by independent third-party agents that are not government entities. So they have an independent eye on what is happening, and they will report to us. In addition to that, we are bringing in the law enforcement institutions, the ICPC, the EFCC, both to guide us as we think about these reforms, but also when there are areas of suspected misuse of funds, they will join us in the investigation and taking action as is necessary. The plan over the next couple of months is to really revise the guidelines that are informing the way the money is used for the Basic Healthcare Provision Fund, and ultimately lock in some of these changes before July, and then we launch BHEPF 2.0. But some of these changes that I've highlighted are happening now. In addition, at the Ministerial Oversight Committee that happened last week, Thursday, the minister chairing the MOC approved, as you have mentioned, the sum of 25.8 billion naira to go through the gateways to the states and onward to the facilities. And to do that and make sure that even before we roll out 2.0, we get maximum value from that, we are going to be using a number of interventions. One is that each state has developed a remediation plan coming out of the state-specific gaps that were found in the way they spend the money. So we're conditioning the release on the implementation of their plans, so that all of the gaps that are found, have a dedicated account, only spend the money on specific items and things like that. So our states are implementing that. That's when they will get the money. Secondly, we're making sure that the facilities that receive the money are those that are actually providing services. So to achieve that, we have right now commenced a nationwide assessment of the facilities. 23 states and the FCT have been completed as of last week, and the other 13 states will be done right after the holiday, just to confirm that the facilities are actually the ones that should be receiving the money, and then make sure that we have all of these additional resources that I've talked about to manage the money. In addition, the minister launched a whistleblowing line where people can call to let us know when the resources are being misused. It's a phone line and an email address. So every Nigerian, we call on Nigerians in every corner of the country, we call on civil society organizations, to pay attention to our facilities. Health workers, when you see anybody trying to misuse the basic healthcare provision funds, the number is 0701 302 1570. Again, it is 0701 302 1570.
All right,
There is
Dr.
also an email address for those who have access to email services. Yes.
So I want to come
alert@health.gov.ng. Thank you.
Quite a lot of information you've given us there, and maybe capture some of my questions. But I hope this phone number is working, because a lot of times when we get phone numbers from government agencies, a lot of times they are not functional. There's nobody to pick it up, and when you have just one line for the whole of Nigeria to call on to, I'm sure you can imagine, what would happen to it. So it would be nice to know that that number is functional, number one, and that there are alternatives that people can really get through to people to answer those calls.
I think, Ine, that's a very valid concern that you have raised. But I should reassure you that one of the tenets of the strategies, both the health sector-wide strategy articulated by the ministers, but also the PHC strategy that is guiding what we are doing, one of the key tenets is really building trust and engaging with citizens to be responsive. So this is not done just randomly. This is done very intentionally. This is the first line that was launched by the minister. The goal is that we will be deploying several other mechanisms. We're going to be having listening sessions. We're going to be, again, like I said earlier, working with CSOs in the communities. We're going to expand the number of lines, both at the Ministry of Health level, but also at the primary health center level, where people can reach. Nigerians will see that. We're going to be sharing information publicly in the newspapers, but also on the websites. When funds are distributed, you will know how much is going where. When we are achieving some of these results that we're committing to, you will see it. We will communicate with you. When we are not doing as well, or we are missing some detail in the field, we will also be looking to hear back from you, because we want to be accountable. We want to hear from you. But I do assure you specifically that this number is working, and you can call it. Again, like you said, we have started with one line, so everybody may not get an immediate response, but I can assure you will find somebody at the end who may be talking to somebody else depending on the volume of calls, but we're working very quickly to expand the number of lines.
All right, so please give us a timeline to this 25.8 billion naira and this plan. Have the social accountability officers been employed? Just give us timeline what to expect, so that when we don't see it at that time, then we know to call that number and say, Doctor, I know this is against what you promised us.
So, thank you very much, Ine. The Ministerial Oversight Committee approved the disbursement of the funds last Thursday. Now, so in the next week or so, the funds should move from the ministry to the gateways. The gateways are now working on a state-by-state basis to say, have you put measures in place that makes sure that we don't repeat some of the errors of the past, that make sure that some of the gaps have been plugged. So over the next 2 weeks to a month, we are anticipating that most of the states will get the funds as appropriate and be able to pass it on to the facilities that have been revalidated and qualified. Now, between now and June is when we are then putting in all of the medium to longer term interventions that will be incorporated into BHCPF 2.0. So we have commenced the recruitment for the social accountability officers, or what we also call performance and financial management officers. We are engaging with CSOs already. We are making the technology we're developing the technology solutions that will be rolled out to create the transparency that I'm talking about, amongst other design interventions that we're making on the way we are operating the basic healthcare program, both on our side but also on the demand side, which is the NHIA side. So I can guarantee Nigerians that by July, when we roll out, all of these things will be in place. And in fact, Nigerians will already start to see the work that we're doing to really transform the quality of the primary health centers across the country.
Thank you so much for that very clear timeline. Dr. Muyi Aino, the Chief Executive Officer of National Primary Healthcare Development Agency, and we certainly look forward to having more primary healthcare centers in the country.
Thank you.